Welcome to Doctors in the House. My name is Dr. Darrell Hill, and as always, it is my pleasure to be here with you in the house. As always, we love to talk about health and medical issues, anything and everything. And today, we are very privileged and fortunate to have Dr. Darrell Andrews in the house with us. So I'm going to go ahead and just kind of open it up and give Dr. Andrews a chance to just tell us who he is and what he does.
Hello all. Again, I'm Dr. Darrell Andrews. I'm happy to be here. I'm very privileged to be here. Thank you, Dr. Hill, for having me on. I am a chiropractor. I'm a chiropractor in the state of Maryland. I just opened a second office, so I have two locations here in PG County. One on the north side in Laurel, Maryland, and one on the south side of PG County, Fort Washington. I've been practicing for about 13 years now, 8 on my own, and I love what I do.
Great stuff, and I definitely want to come back to that part about you practicing on your own too, but go ahead and just tell us, what exactly do chiropractors do?
As a chiropractor, I'm a musculoskeletal doctor. We really focus on musculoskeletal injuries. Most people come into a chiropractor for, as we talked about off air, low back pain.
Okay.
But it's actually much more than that. It's any joint really that we can treat. Neck pain, headaches, shoulder pain, knee pain, in addition to low back pain. But any joint that can go out of alignment, which is most of them, is something that a chiropractor will treat.
Okay. And usually, are they coming to you, say, for a week or weeks or a shorter period of time?
It really depends. It depends. It really depends on the mechanism of injury. So, for instance, I treat a wide variety of patients as far as why they're sent into the office. So, okay. Personal injury patients are one of the big things that, or one of the big type of patients that I see as far as volume. Patients that have been in car accidents, slips and falls, things of that nature. And, most sprained strains heal with therapy usually between 4 and 6 weeks. So okay. I may see a patient, on average between 4 and 6 weeks, depending on the mechanism of injury.
Right. And usually, say, go back to the headache issue. Are you going to be focusing more on the neck area or the low back for that?
For headache?
Yeah.
Definitely the neck. Most headaches, 80% of the time, headache is tension related. And we all have stress.
Right.
We all have stress. We all have tension as a result of stress, and most of us hold our tension right in our shoulders. Because of that, tension headaches are very, very common. And as a chiropractor, I'm focusing on the upper cervicals, which is right below the skull, and really focusing on getting movement there and alleviating headache pain.
Well, I tell you, as I mentioned off air, I'm looking forward to the conversation we're having, because as I listen to you, much like our audience, I'm being educated too. So, let me apologize now if I ask you any questions that just don't make any sense or just so basic. But one of the questions that comes to mind to me is, say you get a massage in your neck and shoulder area. How do you differ from what that person is doing? What are you doing?
So I have massage therapists that I work with. So I added massage therapy to my offices about 6 years ago, because we are different, and we differ in the respect that we're getting joint movement. We're as chiropractors, we're getting joint movement. Massage therapy strictly focusing on the soft tissue. There may be some joint movement if the area is so tight. The joint may move because soft tissue, as you know, a muscle attached to bone. So that you may get some movement, but it's not specific. Chiropractic is a specific scientific movement of the joint, so for the most part, that's how we differ.
I love how you explain that scientific movement of the joint.
Yes.
And we're going to get into your education, but I'm wondering too, what are some of the challenges with the massage therapy stuff compared to what you're doing? And are you doing all the manipulation with your hand or using machines too? Because you said movement of the joint That's pretty serious stuff.
Absolutely. So to answer your first question, massage therapy. I think you're asking how does it differ as far as like how it's delivered, or
Pretty much.
So everything is with the hands. There are instrumentations now that's used in order to deliver an adjustment. I lean more towards actually using my hands. That's how we learned.
Okay.
Chiropractor does mean practicing with the hands, and for over 100 years, that's how it's been delivered, the actual adjustment. So
wow.
It's very safe. It's very again specific, and it's more speed than it is power. So in regards to the massage and how it differs, again, focusing more on the soft tissue. It's more superficial, and the adjustment is, obviously getting to that joint layer and making sure we get movement in there.
That's cool. I'm actually sitting here and I'm thinking in the future we got to bring in a patient and watch you do your thing, man. I'm feeling that.
We can do that. We absolutely can do that. There's plenty of room in here.
Well, let's go ahead and talk about the education to be a chiropractor. I know it takes time, and I know it takes some money too, man. So let's hear about that.
Yeah, man. So school loans are probably close to $200,000.
$200,000.
$200,000 in school loans. So it is a hefty school bill, if you will. But I think it's worth it. I went to school. I'm a Hampton grad, so I did my 4 years at a HBCU.
HU.
And then it's a 5-year chiropractic program that you can do what they call an accelerated program, where it's just basically year-round school. So I had the privilege of going to Palmer College of Chiropractic, which is in Davenport, Iowa. The importance of that, chiropractic was founded in Davenport, Iowa. Palmer College was the very first chiropractic college.
Really?
The very first.
Wow.
So it's the Ivy League school of chiropractic colleges.
Elite education.
Elite education, and there's an accelerated program where it's basically just year-round school. So we did trimesters as opposed to semesters, and we had about a week off, if that, maybe 7 to 10 days. Worth of time off between trimesters, and then we just kept going, man.
So are you saying you got to do the 4 years of college and then do chiropractic school?
Absolutely.
And that's a 4-year program.
That's a 4 to 5 year program. It may have changed now, but it is a 4 to 5 year program that, with the accelerated, you can do in 3.5 years or so.
Okay. And when you say $200,000, that includes your undergrad too, or just the chiropractic?
That included my undergrad. I want to say chiropractic was maybe about 150 of that.
Okay. Wow. So at what point did you kind of know you wanted to be a chiropractor?
I'll take it back to maybe high school. Ninth or 10th grade or so, I was very interested in a physiology class that I had in 10th grade. My teacher's name was Mr. Bartow. I remember the guy's name.
Bartow.
Yeah, Mr. Bartow. I sat in the front. One of the few classes I really engaged and sat in the front, and we learned about the function of the human body, and anatomy and biology, different things of that nature also intrigued me. But this physiology class really piqued my interest. We had a family friend that was a chiropractor. My mom and dad, coincidentally, were seeing this guy when we were very small. They used to take us to his office. And I say I'm a twin. I'm a twin. I have a twin brother.
Okay.
My twin brother is also a chiropractor.
Wow.
He practices in Richmond, Virginia. But they used to take us to the office, and we just kind of play in his play area or what have you. Had no idea about what was going on and what they were doing there. But as we got of age, he just kind of mentioned to my parents if we were interested, maybe to look into it, and that's what we did.
Okay. Well, that's good stuff, man. I'm really learning a lot here. So tell me, what is a typical day for you at the office?
Typical day, I get in the office about 7:30, start seeing patients about 9, and we go until about 6 or 7 o'clock, Monday through Friday, and we go from there. I'm not as hands-on as I used to be. With me opening the second office, I'm doing more of working on the business as opposed to in the business. But with me opening the second office, I am a little bit more hands-on than I was maybe a year and a half ago. We just really get the patients in, focus on what their needs are, and we go from there.
Okay. Wow. So you got the two offices.
Yes.
Where are they again?
Laurel, Maryland, and Fort Washington, Maryland.
Okay. What are some of the challenges to opening up this new office that you're finding, and some of the things you enjoy most about opening a new office?
So some of the things I enjoy most is the exposure. It's been a while since I've been out, kind of getting different types of exposure. It's been about 8 years since I opened my first office. So, there's different marketing and things of that nature that come to play when you're opening a practice. And you can get complacent, you can get comfortable, when you have a practice that's thriving over the course of 7 years or so. And so now, I'm kind of back in the marketing game a little bit, and I realized how much, I missed it.
Right.
But on the flip side, that's the frustrating part as well. Because I was, kind of stuck in my ways a little bit as far as, how I, introduced myself in my office to patients. So, you can get complacent, man. You can get complacent. You can kind of get into a rhythm. I'm not single anymore. So when I opened my first office, I was single. Now I'm married with a beautiful son, and so that kind of takes precedence over a lot of different things as well.
Trying to find that right balance.
Absolutely.
Same thing here. And I'm really excited too as we sit here and talk, because, as a society and as a healthcare community, this whole opioid epidemic and management of chronic pain has just been through the roof.
Right.
So that chiropractic ability to manage the pain has got to be great. So what are you seeing in that respect?
Well, I'm seeing that as you are. I'm seeing that increase over these last few years. It's a lot of chiropractors are being referred to by government programs, to help stop the opioid epidemic. And I get a number of different patients that come in that even before this that were I don't want to take medicine, or I don't want to do this, I don't want to do that, and I'm usually their last resort. They've tried everything in the medicine cabinet and then some. Which is fine, because we're different. We're on the other side of the spectrum. We're not, within the traditional, scope of practicing medicine, if you will. To your question, the opioid epidemic is showing us that, there's a thin line between, the use of, prescribed meds and the abuse of prescribed meds.
Right. And I'm really excited too, because what I'm seeing in my office historically, I would only refer to the chiropractor after we went through those usual disciplines. And somewhere around maybe a year or two ago, I really started doing a lot of referrals out to the chiropractors. And you probably have noticed it yourself too. The amount of chiropractors now just seem to be everywhere. There's quite a bit of them. Are you noticing that too?
Well, particularly in areas that have a school, it's very saturated.
Okay.
I think there could be more, to be honest with you. I think there could be more. But I'm noticing that I'm getting a lot more referrals from MDs. And that's actually happened for me over the last 5 years. It's picked up for me. So pain management specialists, internal medicine docs as yourself, orthopedics, not as much, but orthopedics, neurologists.
What about physical therapists? Are they referring to you?
Some.
That was a joke, by the
way. Some. Yeah, there's some tension. There's some tension. There's some tension there, but not on my end. Because really we do some similar things, but we do some different things. We spoke a couple days ago about a physical therapist that actually came to see me for care. And this guy has his own offices and could very well go to his own offices for therapy and for treatment for his issue. But he sought me out because he knows that we are different.
Right. Well, now might be a good point to talk about those differences. How do you differ, physical therapy and chiropractor?
All right. Well, physical therapy, and I'm not a physical therapist, so it's strictly just my opinion, right? But physical therapy focuses more on restoring function through exercises and different things of that nature. Soft tissue modalities, i.e. ice, heat, muscle stim, ultrasound, things of that nature, and again, exercises. Chiropractic does those things. If in Maryland, for instance, you need a license to actually practice those things, which I have, but we do those things in addition to the adjustment, so the actual movement of the joint. I think they're both very important for the patient because, as I mentioned earlier, soft tissue and muscle attached to bone. So if you have a tense muscle, you have deconditioned soft tissue, as I call it, that can happen over the years. You have a weakness there that can't necessarily just be restored through exercises. If we're trying to restore function to an area that's dysfunctional, it can cause more pain and trouble than it can help.
Now, would that be more of the physical therapy part, that restoring muscle and building muscle in the area that's kind of not so strong anymore, or is that still in the chiropractic world?
It's both, but but I'd say it's more in the chiropractic world because of the joint. The joint when the joint gets pulled out of alignment, it's dysfunctional. Right. So the spine is meant to function in a certain place, you know, just like anything else. So it's meant to function in a certain place. When it gets pulled out of alignment, which in chiropractic we call subluxations, a misalignment of the spine, it causes pressure on the nerves, which innervate muscle, which attaches to bone, which presses nerve, which innervates muscle. So there's a dysfunctional cycle now that's created, whether it be acute, whether it be chronic, that needs to be restored in order to actually achieve full 100% function.
Yeah, the more I'm talking to you, the more all these patients are popping in my head. I got to refer out to you.
That's awesome.
The easy ones are the chronic arthritic conditions, the sciatica, the spinal stenosis, my chronic headache patient that comes to mind, and it's really good to know that we have this resource out there. And what I'm going to be doing, we use these sessions to refer patients back to. So what would you say to that chronic pain patient we just talked about, how you could help them? What would you do for that patient if you saw them in general?
Okay, well, I'd evaluate, the mechanism of injury. I'd evaluate how we got here. How long have you been dealing with this pain? What are you doing to help alleviate the pain, if anything? Is it pain meds? Is it stretching? Is it what do you do on a daily basis? Do you go to work and sit at a computer all day? Are you a carpenter? Are you a mechanic? We'd evaluate exactly what you do on a daily basis that deconditions your spine, deconditions the soft tissues around your spine, and then we'd figure out a plan that's specific to that particular patient to help restore function to those areas. I do get a number of patients that are in chronic pain, and again, chiropractic is usually the last resort. We'll try a number of different things. Massage therapy is one of the big things because we've all, if we've had a massage, massages feel good, right? And we want to do some things that.
I think I want one right now.
Yeah, exactly. We want to do things that help us feel good, that help us feel better, but when we're educated as far as what it is that in this instance a chiropractor does and how we differ, then we can understand how we can actually take that feeling a step further. We can associate, this may be a question of yours later, but we can associate chiropractic with pain. I'm here to tell you it's not painful. It's more speed than power. It is more technique than anything else, and it's really a matter of making sure that everything around the joint that we're looking to move is relaxed, you know, and as long as it's relaxed and you know, and all things are being equal, you know, we should be leaving out or actually feeling better, not worse.
And typically that person might have to come back every 2 or 3 days to help maintain.
You know, it really depends. I go on a 12 visit kind of routine where I reevaluate patients every 12 visits. And so that could be 3 days a week for 4 weeks. That could be twice a week for 6 weeks, or it could be once a week for 12 weeks. It really just depends on, you know, some of the aforementioned things. How did we get here? And then we go from there.
Quick question, you know, I see those motor vehicle patients coming in and they might have some minor pain or no pain. Could both of those patients benefit from seeing you?
Absolutely. Chiropractic is not only reactive, it's proactive. All right. So proactive, you know, so I get a number of patients. I have a number of patients who come into the office because they are in pain. I have a number of patients who come into the office because they want to stay out of pain. So yes, there are patients who, and you know, specific to your question, that can benefit whether they are in pain or not from a car accident, because pain's typically the last thing to come, not the first. Dysfunction can manifest for some time before pain happens. So I do educate my patients on that. If a patient was in an accident, say yesterday, they really have up until 2 weeks before they'll feel any pain. You know, and a lot of that is adrenaline. You know, the sympathetic nervous system, the fight or flight. A lot of that, you know, they're reliving the actual event over and over and over again. So their adrenaline's running high. They're not really feeling anything, or what they have is they dismiss. Oh, it's minor. It's no big deal. I just need to get back to work. This, that, and the third. They're not really being really forthcoming about what's going on with them because they have things to do. They feel like they're in an accident. That life is going to stop. And it can't, you know, for most people. So, you know, a lot of people that come in, you know, can absolutely benefit whether they feel like they're in pain or not.
Well, I'm enjoying this conversation. Once again, you are in the house with Dr. Darrell Hill with our guest, Dr.Darrell Andrews, chiropractor here in Maryland. Well, let's go ahead and talk about, anytime we talk about patients who are appropriate for you, who are those patients who might not be appropriate for you?
That's a good question.
Not to put you on the spot.
Right. That's a great question. You know, I don't look at any patient as a patient that I can't help in one way, shape, or form. We do massage therapy. We do rehab. We do chiropractic. We do physiotherapy. We do a number of different things. We do detox in my office. So we do a number of different things that I feel like that can help a patient. Now, stress doesn't take a day off, right? So
24/7.
24/7. So I go by the rule of thoughts, traumas, toxins, the 3 T's. So I treat thoughts, traumas, toxins. So your thoughts, you know, how you feel, your stress levels, which again, stress doesn't take a day off. But stress comes in 2 other forms. It comes in the form of trauma, which we've talked about, you know, personal injury, car accidents, slips and falls, exercise. Exercise is a side of is a type of physical stress. It's good stress, but still stress. And the last T is toxins, what we eat. What we eat puts a lot of stress on our nervous system, which in turn puts a lot of stress on our spine and the soft tissues that support our spine.
Well, you know, it's funny. The reason why I bring that question up is because sometimes, as you can imagine, with chronic pain, we see some pretty bad off patients. And the patient that came to mind and comes to mind is that patient with spinal stenosis.
Okay.
Some of those patients are so fragile and tenuous that I've seen some therapists, for example, and chiropractors who don't want to touch them because if you manipulate it the wrong way, you might further worsen their situation. What's your opinion on that?
So, you know, we'll address how they got there. You know, we'll address how they got there. We'll look at any other practitioners, any other doctors that they've been to, and we'll just evaluate what we have in front of us. Stenosis. Like you said, there's different levels of stenosis, and you have some patients who are very bad. Have very bad stenosis. So, but there's a number of different methods in chiropractic. Joint movement with the hands is just one of them.
Right.
There's a process called flexion distraction, which is basically the pumping of the joint of the disc. That's mechanical. That's done via table, typically, where we're basically stretching the spine. So as you know, stenosis is the closing down of the foramen, right?
Absolutely.
On the nerve. So it could be because of disc bulging, disc herniations, or some other type of debris if we distract the particular area, can cause some immediate relief for a patient.
Well, I can tell you, the Laurel community, we are happy to have you guys. We're looking forward to you guys helping to relieve pain and to help keep people healthy. We are approaching our first break. I can't believe it. It's already been a half hour.
Really?
It's moving. Learning a lot, and I hope our audience is learning a lot too. Once again, you are listening to Doctors in the House. My name is Dr. Darrell Hill. I'm a part of Laurel Medical Associates. We can be reached at 301-497-0401, and we are always open on the web at laurelmedicine.com. So I think we're going to go ahead and take a break, and we'll come back and we're going to get into talking about the insurance industry, talking about what it's like for you as an African-American chiropractor.
Awesome.
And we're going to talk about all the things that can help our audience stay healthy. Let's go to break.
Business owners looking for a place to advertise your business and promote your products and services? VoxWave is the right place. We have over 10,000 views a day and 70,000 listeners a month. For more information, contact Reg Gaskins at 240-832-4455.
VoxWave now features a streaming radio media player on our website's front page, where local artists can get their music played 24/7. For more information on getting your music in rotation or to perform live at our studio, contact Reg Gaskins at 240-832-4455.
Android users, the VoxWave app is now available in the Google Play Store. Download the app today on your Android device to listen in and view programs.
Well, we are back with Doctors in the House. My name again is Dr. Darrell Hill, and we are privileged to have Dr. Darrell Andrews in the house. Why don't you go ahead and just mention again your office locations and your phone number and address.
All right. It's Andrews Connected Care. We just recently changed our name and brand from Andrews Chiropractic Center. So Andrews Connected Care, we are located in Fort Washington, Maryland and Laurel, Maryland. As of now, we are continuing to expand. Phone number 301-292-1960, and I can be reached on the web, www.andrewsconnectedcare.com.
Yes, Doctors in the House. We're all about educating you and helping to keep you healthy. And today we are talking all things about being a chiropractor and the services provided to help keep you healthy. So let's turn our subject now to the insurance industry.
Okay.
You know, I hate to have to bring up insurance, but it's important. It's important.
Absolutely.
So give us an idea. Are most of your services being covered?
No.
Okay.
Most of them are not being covered. And if they are being covered, there's the insurance companies have a fee schedule.
Okay.
So they have their own set fee schedule. It resets every year or 2 years or so, and they send out they send out an email now, in a long packet just of different codes and what they're going to pay for said codes, and we go from there. But if I charge $20 for my services, they may pay
a nickel.
$8.
A nickel.
yeah. I was trying to give them the benefit of the doubt. They may pay $8, and that's that. I have to write off the other 12. So.
Yeah, it's interesting as I sit here and talk to you. I'm being reminded about how old I am now, because I believe I was in maybe residency, because there was a time when none of this stuff was covered on chiropractic services. And I remember it then being covered, and everybody was so excited. Right. What was that, about 15 years ago, maybe?
It's been a while. It's been longer than I've been practicing. So as far as the coverage, so I don't have a date.
Okay.
I don't have a date, but I know every year more and more insurance companies are getting on board, and I mean they're even coming up with new insurance groups to include other patients that may not be aware of chiropractic services.
Yeah, and I think in this age of wellness and prevention and alternative options, it's good to have this being covered, because now more and more people want to take advantage of it.
Absolutely.
So that's good to know. Anything else you want to mention about any bill-related activities or insurance that might help educate our patients out there?
Well, as you said, insurance is a sore topic, but in regards to my office, we are providers under most of the major insurance companies, including Medicare. So any of your referrals that we see a lot of Blue Cross Blue Shield, Aetna. Kaiser now. Kaiser is actually, as of, I want to say, maybe 2009, Kaiser in Maryland is actually referring to chiropractors now. Okay. I want to say they're under an umbrella of Optum Health. I don't know if you're familiar with Optum Health, but Optum Health is an umbrella company that has a number of different insurance companies under there. I want to say Kaiser is involved under that umbrella. Okay. But Andrews Connected Care is a provider under a number of different insurance companies. So anyone who comes in, we don't set the co-pays or what your out-of-pocket costs are. Sometimes that's a misconception. Yeah. We do not set the out-of-pocket costs. Your insurance company does, and whatever plan you have with them. But the good thing is it can cut your bill or whatever the expense from maybe $100 some a visit to maybe 20, and where the insurance is covering, 80% of it, and the patient may have to cover 20% or nothing. Okay.
Yeah, that's good to know. So let's go ahead and talk briefly. What I see these days, more and more people using the computers at your desk for extended periods of time, and more what our routines are. They're not normal, but they're normal. Right. And it's putting a strain on the body. So what's your opinion on that? And from a chiropractor standpoint, What's your opinion about making it better?
So they're abnormally normal, huh? I talk to my patients about sitting quite a bit. There's an article and some studies out that are saying sitting is the new smoking.
Wow,
it's
sedentary.
It can be that dangerous now because a lot of us are doing it, and here's why. We get into these routines of sitting, and our posture just isn't what it should be, right? So the more comfortable we get, in an environment, the lazier we get, right? And our spine takes the bulk of that stress, and over the course of this chronic routine, our muscles, which are meant to support joints, well, they get weak,
right?
And they decondition. So now they're not supporting joints. So now you have muscles that are weak, some that are doing more work, so they're tense. You have joints that are now out of alignment. You have nerve pressure now, and you have that over the course of time. You'll have pain.
Wow. So ergonomically, or do you recommend any types of specific chairs or something like that?
So I write quite a few letters in my office, recommending ergonomic chairs or. The Varidesk is very popular now, where we have patients who are, standing at work now, which is, I guess the offset of, the offset of sitting all the time. So I do recommend ergonomic chairs and ergonomic desks and things of that nature. But I recommend stretching more. There's a number of things that are being taken out of schools. One of them is PE, right?
And I can't believe that, man.
I grew up with PE class.
Loved
I grew up
it.
with the shorts and the high tube socks and the T-shirt that was given to you with your school name on it. And we don't have PE class anymore. It's not mandatory anymore, and so we don't stretch enough. So I have a number of patients who come in that are workout warriors and former athletes such as myself. I played basketball and I wasn't really, I didn't really stretch a lot before I played. I thought it was bad luck actually before I played, and so we don't stretch as much as we used to, and much like the these old cars, these old classic cars that we have now, we have to do more work to them to get them to run than say a 2019 Hyundai, right? So. We don't do enough of some of the things we used to do in the past to keep our bodies mobile and pliable.
Well, you make a good point, and sometimes I forget that we got to just stop for a second and talk about how sedentary we are, how now our young people are more obese, more medical issues, which means more work for me and more work for you too. Right. So we want to continue to encourage people to get out there and stay active, eat right, and try to maintain your weight, because otherwise we're going to deal with some issues sooner, especially than later.
Absolutely. So, absolutely. Thoughts, traumas, toxins, man. Thoughts, traumas, toxins. So that kind of hits the nail on the head.
So let's change the topic just a little bit. Any new developments in your industry as far as new concepts, new techniques, new tools that chiropractors are starting to get involved with?
So maybe more so on the therapy side.
Okay.
Not so much on the chiropractic side. There's one way to deliver an adjustment, right? That we've learned, to different parts of the spine. So there are some instrumentations that have developed over the years that help to take the stress off of the practitioner, because it can be pretty demanding, particularly if you have a high volume practice. It can be pretty demanding and a lot of stress on the practitioner's hands and spine. So there are a number of different tools, if you will, that have been developed over the years that kind of help deliver an adjustment or help deliver therapy. But I'm still on the right side of 60, let's say, I still take pride in using my hands and being able to deliver the adjustment with my hands as I was taught, and I think that's the best way to deliver the adjustment. And so so as far as the actual instrumentation, it's there. I have it in my office if it's needed. You know, for instance, a geriatric patient who comes in that may have you know, severe osteoporosis or osteopenia. I may not deliver the same type of adjustment with my hands as I would, say, a 16-year-old or a 25-year-old or someone along that line.
Well, that's good to know. And in this day and age of work and play, let's switch the topic a little bit. What do you do for fun? Who are you outside the office? Whatever you feel comfortable sharing with the audience.
I'm an avid movie watcher, golfer. Golf plays me more than I play golf, but you know, I love the sport, man. I love it. You know, I'm a former athlete, and that competitive drive hasn't really gone anywhere yet. It's still there. It still runs through me daily, and I don't play basketball as much as I used to when I was coming up. But you know, I've transitioned to you know, golf and you know, kind of spending time with the family and things of that nature. You know, my son, as I mentioned earlier, he's 4 going on 5, so you know, he's in swimming, he's in soccer, he's in basketball.
Wow.
So there's a number of different things that, you know, that takes up the weekend. You know, as a matter of fact, as we spoke, I said I had to check with my wife and I had to check with my son's schedule. I'm on his schedule as of Friday, Saturday, and Sunday. So yeah, that's kind of who I am outside of the office. You know, watching movies, trying to get on a golf course, and relaxing with the fam.
Anything unique about your office that might be different from another chiropractor's office? And I guess we're talking about the one in Fort Washington versus Laurel.
Well, I don't know if it's unique. You know, because what we try to do is we try to focus on the patient, the individual. We're really big on customer service in my office. I've picked a lot of brains over the years. You know, I've tried to learn from a number of my colleagues. You know, people who've done this well, you know, before I have and much longer than I have, and you know, I try not to have the patient coming in feeling like a number.
Yeah.
You know, feeling like it's an assembly line. You know, and you know, with some of the high volume practices, you can kind of fall in that trap.
Right.
But you know, at Andrews Connected Care, we really focus on really listening to what the patient has going on and their story, and taking that information and delivering an awesome treatment plan. And
before I forget, do you guys prescribe any medications at all?
We do not.
Okay.
We do not. We leave that to you, Doc.
Oh wow, that's interesting. I was wondering about that.
Yeah.
Okay.
So recommend. You know, I may recommend some things. You know, I have some all natural products in the office, like an all natural muscle relaxer. It's called Formula 303 that I may offer to someone who's coming in that may be on a muscle relaxer that's making them drowsy, and they say, hey, I can't take it the way the doc prescribes it because it puts me to sleep. So I may recommend, you know, an all natural version for them at the time because as we all know, you know, if someone's been in an accident, you know, sprain strain injuries, the muscles are tight and need help, you know. So, but all natural creams, all natural muscle relaxants, and some other things of that nature. But no, we don't write prescriptions.
Well, that's good to know. That's a good thing, though. So let's change the topic just a little bit. And are you able to speak to whether or not you're a part of any chiropractic associations, national, state?
Yeah. So when I was in college, when I was at Palmer College, I was the president for 2 years of the student chapter of the American Black Chiropractic Association. It is a national association for obviously African American chiropractors. I was the president of my chapter for my school for a couple years, and that's continued outside of school. The ABCA is getting bigger. It's not as big as some of the other chiropractic associations. The ICA, the ACA, American Chiropractic Association, and International Chiropractic Association, but it's the one I choose to be a part of because it speaks volumes to you know, really some of the things that I hold valuable, you know, and that's providing great care to our community, which we're underserved.
Right.
We're very underserved. So
yes,
underrepresented and underserved.
It's funny, we tend to always be underserved in these kind of disciplines, unfortunately. So why don't you speak to whether or not what are some of the advantages and disadvantages of being a black chiropractor, if any?
Well, we're in PG County. PG County is the most affluent, African American county in America. So I get the opportunity to serve, my community. The vast majority of my community is within this county in Maryland, right? As far as blacks are concerned. So some of the advantages of that is, typically, a patient will come in and they're looking to support, a black-owned business, and or they want a doctor that looks like them. So there are advantages there. There's disadvantages because there's some of those same people who don't want a doctor that looks like them. And I have dealt with both sides. Particularly early when I first started practicing, I had an individual that came in. He was an older gentleman, and he was amazed that I was a doctor. I was the doctor that was staring him in the face, asking him questions about what was going on, and I treated him that day. I haven't seen him since.
How'd that make you feel, by the way?
And back then, I felt betrayed. Right. I felt a little betrayed, but. I've learned to kind of to accept that as I've garnered more experience within the profession. It doesn't always work out the way we think it's going to work out, right? So it's just a matter of I can only do what I was trained to do and go and set the right expectations and do my best to exceed those expectations. And as long as I do that. Well, if you don't come back, I feel like it wasn't because of me. It wasn't because of something that we did. It was just maybe the chiropractic experience at that time wasn't for you.
And I think you're exactly right, because at the end of the day, we just have to provide a good service and be professional. And there are going to be people who love what you do and people who don't for different reasons. And if they need to remove themselves from your practice, that's a good thing.
Right.
But it's something we're going to have to face and we have faced, because I've dealt with the same thing, to be honest with you.
Right.
And I'm sure others have too.
I absolutely believe it. I had a recent experience, because again, I'm not in my Fort Washington office as much as I used to be. So I had a recent experience where a patient chimed in about an experience she had at the office when I wasn't there, and she said that it wasn't a good experience and that she was waiting for me to come back. Well, again, this was recent. I've been on vacation. I've been doing some different things in the new office, and I didn't really have a date for her as far as when I would be back in the office. And she went on Facebook and complained.
Whoa!
She went on Facebook and complained. So we've since have reached out to her. And I have an appointment with her next week, matter of fact, to try to get to the bottom of what was going on. But I'm learning that we can get stuck in our ways. We have a preference. So you get in front of a practitioner that you love or that you enjoy, that that you get accustomed to, and you don't want to change practitioners. Right. So the disadvantage of growth is that right there. I'm not going to be in front of my patients as much as I was. Where they felt like, oh well, I can cancel my Wednesday appointment because he'll be there on Friday.
Right.
No, you need to keep your Wednesday appointment now, because I may only be there on Wednesday.
I guess that's the beauty, like you're saying, of growing versus staying small and intimate.
Right. Right.
And taking on new personalities too, because let's not forget about that relationship that's developing between you and that patient. But as long as your philosophy of your practice permeates your practice, should be okay.
Absolutely.
Good stuff. Good stuff. So let's move on a little bit. Anything unique about your chiropractic association that they're doing for you to help you out or bring value to your practice?
I would say it's more of a brotherhood right now than anything else. As far as how I approach it, I use it as an opportunity to reach out to other black future chiropractors, so students who are going through the same journey that I went through, and give them an opportunity to reach out to myself or my staff, come in for an internship or things of that nature. So I use it as an opportunity to kind of give back to the profession, give back to the community, things of that nature.
I'm exactly the same way, because I can still remember when I started my practice, I looked to a more senior person who was more established and kind of gave me a roadmap into being in private practice. So I can appreciate what you're saying there. Very good, very good. So why don't you go ahead once again and tell them who you are and where you're practicing.
Dr.Darrell Andrews of Andrews Connected Care, formerly Andrews Chiropractic Center. We are newly located in Laurel, Maryland, and as of 8 years ago, Fort Washington, Maryland. We can be reached at 301-292-1960 or on the web, www.andrewsconnectedcare.com.
So we had a lot of time today to talk about being a chiropractor and talking about all the wonderful things you can do, especially when it comes to preventing pain and treating pain. I'm hoping our audience learned a lot. I know I learned a lot, and I've got a few patients in my mind right now. I'll be sitting over to your place to see if we can get them all better. You don't do anything for knee pain, do you?
I absolutely do.
I knew you were going to say that.
It's a joint. It's a joint, Dr. Hill. It's a joint. So any joint, and it really depends on what it is, you know. But you know, because I do therapy and chiropractic, you know, it's whether it be, you know, meniscus tears or, you know, some type of soft tissue injury of the joint, we can help rehab that, or even if it's an alignment issue, we can help rehab that. So it is a joint. We can help it.
Yeah, I'm looking forward to getting some patients over to you. You know, I got young patients, some of whom might take chronic NSAIDs or Percocet in some cases, and I think they can really benefit from some of your services. So that Laurel office is right down the street from me. I know exactly where it is, so it's going to work out well.
Awesome.
Anything else you want to add that we didn't maybe talk about?
Let's see. I think we covered a wide variety of topics, right? You know, but just in regards to my particular office, I wouldn't say it's unique, but I'd say that you know, we do focus on the patient. We focus on customer service. We focus on being clean. We focus on being delivering quality service and being consistent. You know, and if you don't receive any of one of those four things, you know, I'm not far. Okay, so we do that with chiropractic. We do that with our rehab and our physical therapy. We do that with our massage therapy. Again, we do detox in the office, things of that nature. So we try to offer a one-stop shop. I do actually have we haven't spoke about this. I do have a medical doc actually that I work with in the Fort Washington location now. That he sees my workers' comp and personal injury patients. So we tag team, if you will, you know, those patients and make sure that, you know, they get a thorough exam, not only from myself but from the medical doc. His name is Dr. Ragland. He has an orthopedic, general surgery, and pain management background, and you know, thus the name change. So the name went from Andrews Chiropractic Center to Andrews Connected Care to basically connect the services, you know, that we offer now, and you know, which is a more wider variety, you know, a wider variety of services that we offer now. So that's chiropractic, medical, massage therapy, and rehab.
So I'm looking forward to getting you back in here and maybe bringing a patient in and seeing you chop up on somebody's back.
Let's make it happen.
Massages. Maybe we can even get Ron, use Ron for that. Put him on the table, man.
Yeah, man. Look, I've already evaluated Ron, man. You know, he's going to be the first patient in here.
There you go. We talked about golf earlier. Anything in particular you might do for a golfer?
Really focus on their posture. Really focus on those postural muscles, those support muscles, mainly those core muscles, your hip flexors, some of the muscles in the lower extremity chain, the hamstrings and the glutes. You know, those are the muscles that really help to support a golf swing. We think it's our thoracic spine, and although that helps, and our lower back, it helps. It's those support muscles that are really weak, that aren't allowing us to turn on the ball or allowing us to have the right stability when we address the ball and come with that backswing and that follow through. So you can tell I play a little bit.
I hear, man. I'm listening, man.
Even with that, it doesn't mean you're going to hit the ball straight. It doesn't mean you're going to hit the ball straight. The contact is still key.
So you understand the philosophy and the theory. Now it's just a matter of hitting the ball right.
Absolutely. Keep that cup face closed. That's what I got for you.
Wow. Well, hey, it's been great.
Pleasure.
Dr. Andrews.
Pleasure.
You all have had the pleasure, I hope, of listening to Doctors in the House. I hope you learned something. We're going to continue to have impactful, educational shows which you can use to stay healthy. We're going to have our diabetes conversations, our heart disease conversations, and with a variety of other activities. So once again, my name is Dr. Darrell Hill, 301-497-0401. Also, laurelmedicine.com. Look forward to seeing you at our next episode.
Cool.